With active COVID cases crossing 30,000 in Shelby County, Monday, for the first time, area medical teams are bracing for a new high of COVID patients. Now, this means a new wave of being stretched and strained to the limit for healthcare workers. Brad Broders is live in downtown Memphis tonight, where the Shelby County Health Director just finished updating county commissioners. So, Brad, what's the latest?
Well, Rudy, Dr. Michelle Taylor said she's hopeful the latest peak of new cases and hospitalizations will be here soon, and then followed by a sharp decline, as is played out with the Omicron surge in other parts of the world already. However, local hospital systems are again bracing for the latest record highs being set for the second time in just months. That's why, again, counselors are playing a significant and very important role.
They're exhausted. Mentally, physically, spiritually, just across the realm.
That's how Sandra Warlow described how doctors and nurses are faring these days on the COVID front lines in the Methodist hospital system.
It's been just really busy.
Day and night, these medical teams are again in the teeth of the latest Omicron-fueled patient surge, with no signs of slowing down.
Just a lot of disappointment. A lot of burnout, a lot of stress.
Warlow leads Methodist's Employee Assistance Program, with counselors for staff again stressed and strained, and going on 2 years straight in this up and down pandemic.
Just lending that ear. We have a lot that call and just want somebody to talk to. Ventilate.
That assisting and consoling is done virtually at all Methodist hospitals, at all hours, on all devices.
If you got a smartphone, you can have a counseling session, telehealth. If you got a computer, just find you an empty room somewhere.
Such talks are timely, as area Methodist hospitals nearly doubled its COVID patient total in just 10 days, with only 4 ICU beds available system-wide Monday morning.
They feel like they're doing hospice work, palliative care, because once they get in the ICU and on the ventilator, the chances really decrease of them coming off. And so just facing death.
On top of that, Warlow said the vast majority of patients seriously sick in Methodist hospitals with COVID remain unvaccinated.
There's a lot of regret, but there's not regret until they get it. They think there's a lot of people out there who still don't think the virus is real. It's a political thing, but it is.
Now, this afternoon at the Shelby County Commission meeting, the health director also again reminded the public to not further burden the local healthcare system and not go to the emergency room to get a COVID test, but instead go to the many COVID testing sites currently open in Shelby County. Live in downtown Memphis, I'm Brad Broders reporting.
All right, here we go again, right, Brad? Thanks a lot.